I was questioning myself, do you really want to do this? And an episode happened that just about crystallized it for me. Since we hadn't started anything, I was trying to understand. I have a friend in the city of Varanasi who is the top eye surgeon in that area. He has a tremendous practice. He goes out to some remote villages once a month and does a free clinic for about 3 hours or so. So here I was there. We talked, and I asked him, hey, could I go with you to one of your clinics? And he took me to one of the clinics. We went there in the afternoon. It was a 3-hour clinic. He had about 200 patients waiting for him. And you can imagine 3 hours has 180 minutes. So if you have 200 patients waiting, it's less than a minute per patient. But anyhow, we sat there. I was sitting next to him, and patients started coming. Since it was an eye clinic, they all had eye problems. And here comes a kid, about 4 or 5 years of age, and he examines and says to the parents are standing there, he will be blind for the rest of his life. Okay, I heard that, but I was quiet. And then some more patients come. 10 minutes later, another kid comes. Here is a girl, I think about 5 or 6 years of age. He examines quickly. Same story, tells the parents she will be blind for the rest of her life. This way, about half a dozen kids came, and then I asked him, I said, hey, what's the problem? Why would they be? Oh, he said they have cataract. And I said, cataract? I thought people get cataract at my age, not when they are 3, 4, or 5. He said, no, they get cataract when they are babies. And that comes from vitamin A deficiency. And it goes unnoticed because they don't have a health care system like we have, that when your baby is born, you take the baby to the doctor, it's examined, can't talk, can't say anything, but eyes, ears, everything are examined, and if there is a deficiency, it's diagnosed and treated. There is no system like that. So it goes unnoticed till the kid is maybe 3, 4 years old, and the parents see, oh, can't see properly. There must be something wrong with the eyes. But they don't bring the kid to the doctor in the city because he charges 150 rupees or 200 rupees. That's their monthly income. So they wait till there is a clinic, free clinic, and that's just a little too late. And believe me, I get emotional when that story I think of. I was staying in a small hotel in Varanasi city. Every day I would, go out to the villages and so forth, but I would come back, and that evening when I came back, I literally cried. I could not see the justice in a 5-year-old kid going blind for the rest of her or his life, and what would their future be? They would end up on the streets of Calcutta or Bombay or Delhi begging. That's their future. And that evening I had my answer. I said, Abul, if you could save 10 kids like that in a year, that's done. I will be happy, I'll be satisfied. Yes, it's a drop in the ocean, and I was determined that evening that, hey, I will start this mission, and 2 years later we did.